Hi, good evening to all of you. Today, as part of our special class on YouTube on Unacademy platform, I shall be discussing one of the most important current affairs topics, policy failures in corona crisis management. So, let us discuss this topic from the point of view of General Paper 3, you have disaster management. Similarly, in your ethics case studies also, this becomes very important. Let us look at these things from that perspective. As you know, disaster or crisis management involves four important steps. First one is mitigation or prevention. Second one is preparedness. Third one is response. Fourth one is recovery and rehabilitation. Mitigation or preparedness is what we will be looking when we want to take proactive measures to stop the impact of the disaster. Mitigation is when you can reduce the impact of the disaster. Prevention is when you can prevent the disaster. For example, this mitigation is for natural disasters, prevention is for man-made disasters. If you look at corona, it is a natural disaster, so it cannot be prevented. The only way we can do is mitigate the impact of the disaster. Preparedness is also part of what we call this proactive measures of disaster management. Preparedness is also. Now, the third one is response. This response is part of reactive measures of disaster management. This response is part of what we call reactive measures of disaster management. And the last one is recovery and rehabilitation. This response would lead to recovery and rehabilitation in the medium and long term, which helps to mitigate or prevent the disaster in the long term. This is what we call a disaster cycle. Proceeding further, let us look at these things from corona perspective. As you know, corona is basically a once in a century crisis. You cannot prevent this kind of disasters. The focus should be on response, recovery, and rehabilitation. And if we talk about preventing these kind of disasters, it takes a very, very long and hard journey. We must completely change the way human beings exploit this earth in the name of their growth and development. So it's a very long-term kind of thing. Now, coming back here, if you look at this, almost all governments in the world had opted for a trial and error policy to mitigate the impact of the disaster. Because remember, last year, in 2019, in November, when it was discussed for the first time in China, and when it had spread to the rest of the world, simply people did not know how to respond to this disaster. Why? Because thanks to globalization, it has spread to the rest of the world very fast, the virus. It has spread to the rest of the world very fast. And it would take a very long period of time for people to come out with vaccines, as can be seen in other cases. As you can see here, even multilateral institutions like WHO also have failed to come out with a definitive strategy to tackle the disaster. And Indian government opted for extreme strategies to reduce the impact of disaster. Indian government, in the first case of corona, was seen in India in January last year. And by February, the cases were slowly increasing. In the month of March, the government of India had taken a very, very significant decision to impose a very strict lockdown. It was complete and brutal lockdown that was implemented by the government of India. And so, yes, corona, it's a natural disaster which has been converted into man-made disaster thanks to globalization. So you can say that it is also man-made, but it is a you can say natural as well as man-made disaster. Next, this lockdown was extended by Indian government for more than 2 months. Again, it was a very harsh step. Why it was very harsh step? Because the government did not give opportunity for people to relocate to their hometowns. And what was the idea behind this announcing lockdown all of a sudden? Because the government did not want the virus to spread to rural areas. But the government did not anticipate what is called other consequences of this lockdown. It led to huge amount of humanitarian crisis. It led to huge amount of humanitarian crisis. Unprecedented humanitarian crisis in the form of migrant crisis. Unfortunately, the response of the government was not sufficient to tackle this crisis. Hundreds of people died while walking to their hometowns. And what is the problem here? The problem here is that from our bureaucracy point of view, they are efficient in performing what we call regulatory functions. They can easily maintain law and order. They can easily restrict the movement of the people, but not good at welfare and disaster management functions. As we study in disaster management can be successful only when bureaucracy has empathy. They must feel the sufferings of the people who are impacted by the disasters. They should rise above rules and regulations. They should come up with innovative ways. Unfortunately, our bureaucracy never really bothered to look at all these things. Our new bureaucracy was more interested in performing what is called regulatory functions during this period. Why? Because they were given the job of implementing the strict lockdown. So when these people, workers, migrants were walking hundreds of kilometers, instead of helping them, instead of coming to their rescue, they were beaten severely by police forces for violating the lockdown restrictions. They were walking on the streets, they were walking on the national highways, they were walking on railway lines. Some of them have lost their life also. Most of them died coming under trucks and trains also. These kind of things can happen only in India. Complete failure of disaster management. Next, as the government wanted, as part of its disaster management, maintain a balance between lives and livelihoods. Unfortunately, finally, the government could not maintain this balance between the lives and livelihood. Both of them were lost. Yes. And during this period, the government, yes, during this period, the government has also failed to create the necessary infrastructure to tackle the crisis. And as you know, by once the lockdown was relaxed, the cases started increasing. They went up to almost 1 lakh cases per day. And fortunately, for the country, the cases started coming down. Most of the state governments have created temporary health infrastructure. And fortunately for the country, the cases started coming down. The death rate also was less compared to foreign countries, even though the statistics provided by the Government of India cannot be relied upon to know about the exact amount of disaster. Now, let us look at the policy failures during the second wave of Corona. What was the problem during the second wave of Corona? So, this is where we can see maximum amount of problem. As I said, by September, the cases started coming down. By December last year, it was almost completely normal. Due to the strict lockdown that the government had imposed, GDP growth rate had come down by minus 24.5%. Among all the countries that had imposed lockdown, India had the worst kind of GDP numbers because of the strict lockdown that the country had imposed. On a scale of 1 to 10, India's lockdown was almost 10. We had opted for that brutal complete lockdown. Then the government started learning from the mistakes, and the government had focused on reviving the economy in the right manner. So the government had come out with some important reforms in the economy. They had come out with initiatives like Atmanirbhar Bharat, and they were focused on reviving the economy. From September onwards, the government went on focusing on reviving the economy. This is where the government had failed to learn from the experience of developed countries. When the government, those who are in the government, when they say that they never expected this kind of a severe second wave of corona, you don't know whether to laugh or cry. It seems that they were completely oblivious, blind to what was happening in the rest of the world. In the age of globalization, in the age of so much of information, when you say that you don't expect this kind of severe wave, it shows complete failure of policy of the government. They simply did not want to acknowledge the presence of the second wave in foreign countries. On the other hand, what the government has done is, on the other hand, what the government has done is, the government has started patting itself on the back by saying that because of the measures taken by the government, the first wave was successfully tackled, and we had become Vishwagurus, and we started teaching lessons to the developed world regarding how to tackle the crisis. We went into complacency, and we started praising ourselves without realizing the danger that was there in our backyard. The signals were also ignored, either deliberately or consciously, most importantly, criminally. Right? Proceeding further, as you can see here, this is some kind of slight, I would not say distraction. Since Unacademy is coming out with special offers, you can see here, during this lockdown period, they wanted the candidates to benefit out of this offers given by Unacademy. You can see here they are coming out with this mega offer which you can avail of. Today the last date, so go and hurry and subscribe to these offers. And if you want to subscribe to these offers, you can use this code, or you can use my code also, PKS10. You can use the PKS10 to subscribe to these offers. And another one is game changer offer, 6 months combo offer, 6 months years plus 6 months optional. Get additional 1 month if you subscribe only on 19th May. You can subscribe to all these offers also, right? Then this is the link also. You can go to Unacademy website. You can find this link also, right? So let us come back and look at what we are discussing. So what were the mistakes committed by the government of India during the second wave? That is what we are looking at. What are the mistakes? We opened up our economy much sooner and it ignored the signals, warning signals coming from Maharashtra and other states. As I said, by September last year, the government was focusing only on two things. One is economy, second one is polity. It has completely ignored the disaster. The government servants, ministers, as well as top level bureaucrats started behaving as if there was no corona in the country. Everything was quite completely normal. Here again we have to talk about another major policy failure here. The government had given 2 institutions to produce vaccines. But when they were producing vaccines, the government did not give them any orders. How can a private organization produce something when they are not sure about the demand for it? How can they create the supply when there is no demand, when they are not sure about demand for it? This is where again the government committed a blunder. Why? Because even though in the budget our finance minister had allocated 35,000 crores of rupees, what we can see from the actions of the government was that this allocation only for the namesake. The government was not at all serious about vaccines. On the other hand, when Donald Trump, Donald Trump was the president of America, he had given $2 billion in assistance to Pfizer and other companies to produce vaccines. That is what is called foresight. As I said, proactiveness is very, very important for disaster management. You must be proactive, you must be dynamic, you must be a visionary. On the other hand, our government had become a blind visionary. That is where the problem is. The government could have given orders to both the vaccine companies in India to produce vaccines. Even a kindergarten student would say that India requires at least 200 a billion doses, 2 billion doses of vaccine, 200 crores of vaccines, with a population of 140 crores. But the government did not give them any orders because the government went into this complacency that this corona had completely disappeared from the country. Completely unscientific, irrational approach. And the government had come out with various arguments. When the scientific advisor to the government of India comes out with such spurious arguments, what can you say? They came out with the various arguments that Indians have a better immune system. That is the reason why corona has disappeared. They came out with the arguments that Indians use a lot of spices in their foods. That is the reason why virus has disappeared. They came out with the arguments that our body can withstand those kind of viruses. That is the reason why it has disappeared. Completely illogical, irrational in a approach of the government here. Completely illogical, unscientific approach. And they never looked at those countries which experienced second wave. Thanks to the lockdown, India's first wave was prolonged, was delayed. But by this time, USA, UK, all those countries were experiencing severe second wave. And what they had done, they started producing vaccines on a war footing. On the other hand, in India, the government was fighting wars of other kind. The Prime Minister and the Home Minister were fighting wars in Bengal to win Bengal. They were fighting wars of other kind. And then, even then also, by the month of February, when it was clear that the second wave has entered into India, the government again blindly closed its eyes. Maharashtra was the state where the UK mutant was seen spreading rapidly. Even then, the government did not take any notice. And here we have to talk about, as I can see here, in a sudden disappearance, or at least for a short period of time, made the government completely complacent. And the government, the warning signals coming from Maharashtra were completely ignored. On the other hand, the government officials, the task force that was set up by the government did not meet for 3 crucial critical months. They never met for 3 crucial critical months. Why? Because political executive had not shown any kind of interest in tackling this crisis. They were under the delusion. They were deluding themselves that it has disappeared. And as late as in the month of March, our health minister had the guts to say that we have reached the end of corona. This is what health minister, who himself is a doctor. And on top of it, he was endorsing spurious drugs, presented by these locals, Baba Ramdev and others, which is a crime. In any other country in the world, that person will be punished severely for promoting spurious drugs. But in our country, they are our health ministers. And during the first wave, most of the state governments have created health infrastructure ad hoc that was completely neglected. The response of the government in the first wave was varied from complete centralization to total abdication of responsibility in the second wave. On the other hand, the central government ministers, they kept on saying that health is a state subject. When they imposed a strict lockdown, they did not remember that. When they provided directions to the state governments on a daily basis, They did not have any idea of this health being a state subject. When the joint secretary in the health department comes on television screen every day at 4 o'clock, they don't remember that health is a state subject. So the government complete abdication of its responsibility. During the first wave, our Prime Minister had addressed the nation 4 times in 1 week, one month. In the second wave, he never really bothered to talk to the people. Complete absence of political executive. Complete absence of what we call political executive. Neither the Prime Minister nor Home Minister was seen for a whole the month of April, March. Prime Minister and Home Minister were confined to Bengal. Prime Minister acted as the Prime Minister of Bengal. Home Minister acted as the Home Minister of Bengal. They were fighting the battles of a different kind. And unfortunately, ironically, when the number of cases were more than 2.7 lakhs in a day, Prime Minister attended a huge meeting in Bengal wherein he felt so happy looking at the huge amount of crowds that had come to see him. That is where again a major crime was committed. Next, we have to talk about the institutions here. Whenever a disaster of biblical proportions take place, like what we are witnessing in India, it is not only because of one person. It is because of failure of so many institutions. Parliament never met during this period. Even when Parliament met, the government never had any meaningful, fruitful discussion on the floor of the House. State governments were never consulted. And then, more importantly, institutions like Election Commission. Here, if you look at institutions like Election Commission, the less we talk about it, the better. After TN session in early 1990s, we never had any election commissioner, chief election commissioner or other election commissioners who had the guts to ensure what we call constitutionalism, a very important word which can define the governance of the country. None of the election commissioners, these election commissioners were nothing but an extension of the ruling political party at the center. As Madras High Court rightly mentioned, they should be severely punished for criminal negligence of their duty. Why do they have to conduct elections in such a critical atmosphere? The rest of the world was laughing at us. India had taken almost 30 years of liberalization to gain the respect, to command the respect from the rest of the world. Everything was lost in a period of 1 month. The world is laughing at us, looking at the kind of a banana democracy that we have. The government simply have abdicated their responsibilities. On the other hand, they were trying to shelter under various rules and regulations. Election Commission was a complete failure. ICMR again also failed. The mutations that were taking place, ICMR, if you happen to read the newspapers, they were supposed to collect more than 30,000 samples for corona variants. The number of samples they collected were around only 700. They were supposed to collect 30,000 samples. And what was the reason? The reason is that government did not provide finances. Where is the money for the government when they are giving everything free of cost to the people in the name of subsidies to especially those who are where elections are conducted? Complete getting priorities completely wrong. This is what happened. As you can see, all institutions are a failure. Even media is also a big failure. Media was a big failure. Unfortunately, media in our country has been completely politicized. As the essay topic last year, an unbiased media is necessary to ensure effective functioning of democracy. Unfortunately, in India, media, whether it's print media or electronic media, especially electronic media, was completely politicized. They were never willing to present the facts before the people. And government has become a master in manipulating the facts. World Health Organization recently had requested the government to be more true, more honest with their statistics. It is said that in India by this time, more than 10 lakh people must have died easily because of corona. The governments can lie, but not dead bodies. Those dead bodies which are flowing in the river Ganges can speak more than the entire government can ever imagine. The best orator that we have in our country, our Prime Minister, had become criminally silent. That is where again another problem. Leadership is very, very important when it comes to providing directions in terms of coming out with solutions to these kind of crises. The government went into self-congratulatory mode with the end of the first wave sooner than expected. As you can see here, focus has completely shifted from corona management to economy and more importantly to politics. Elections to 5 states also influenced policymaking of the government with the schedule drawn to suit the ruling party without looking at its implications. And, here we have to talk about the scientific advisors to the government. 3 of them we see all the time on our television screen. Mr. Paul is there, then Randeep Guleria is there, and then Raghram, Ender Raman or something like that, he is also there. And they were never clear about what they are saying. They are spending more time on television screen than providing suggestions to the government. For a country like India, 1.4 billion people with so much of diversity, will it be enough to have 3 people who spend more time on television screen than on providing suggestions to the government? They also have completely failed to warn the government of the severity of the second wave. On the other hand, they kept on saying that everything is fine in the country. They have become more like politicians than scientific advisors. Unfortunately, this is what when the Prime Minister himself does not wear any mask when he is addressing public rallies, can you expect the people to follow the protocols, COVID protocols? So now, when the cases were going almost at 4 lakh per day, the government should have imposed strict lockdown. But the government did not go for lockdown. On the other hand, what did the government do? The government had left it to the state governments to take this lockdown, decision related to lockdown. This is where again central government abdicating its responsibility. If you know, in the month of April, GST collections were 1.4 lakh crores. If the government were to impose lockdown, they would be losing a lot of money. So they did not want to lose money. Unfortunately, for the government, revenues had become much more important than lives of the people. On the other hand, finance minister comes onto the television screen and says that economic reforms will not be affected because of corona crisis. Completely inhuman statements. Let her tell those things to those dead bodies floating in the river Ganges. Now, let us look at what can be done, what should be done. First and foremost, declare national health emergency. Let's impose strict lockdown for at least 3 weeks to stop the spread of the virus. Right now, if you see, the cases are coming down. But why the cases are coming down? I'll just give you an example. Till last week, Karnataka was conducting 1.7 lakh tests per day. And the number of cases that were detected were almost around 50,000. So around 27% positivity rate. On the other hand, yesterday, Karnataka conducted only 97,000 tests. From 1,70,000 to it had come down to 97,000 tests. And the positivity rate is the same, 27-28%. And that is how the cases are coming down in our country. The cases are coming down not because the virus is getting weakened. They are coming down because the number of tests conducted by the state governments are reduced. Because no state government wants to conduct tests and tell the people that there are more number of people affected with corona. And same is the case with the deaths. As I said, no state government. Finally, the Prime Minister had woken up, and 2 days back he had asked the state governments to be honest with their statistics, to come out with the right kind of statistics regarding the deaths as well as the number of people who are affected. There is not even a single family in the entire country at this point of time wherein there is no death due to corona because of their friends or relatives or knowns or anyone else. But the government says that only 2.5 lakh people died. The government, whenever disaster management of this kind of a thing should be done, first and foremost, what is required is honesty, transparency. Unfortunately, both of them are lacking with both the state governments as well as the central government. Next important solution, as you can see here, is for a temporary period of time, nationalize all the private healthcare services to provide free treatment to victims. As you know, even in small towns, also private hospitals not having any kind of facilities are charging 4 lakh rupees, 5 lakh rupees for treatment. Per day they are charging 2 lakh rupees. There is huge amount of exploitation because of the complete failure of public health infrastructure. As Allahabad High Court mentioned the other day, right now in rural areas in Uttar Pradesh, it is only the God who can save the people. The government has completely abdicated its responsibility. So in the medium and long term, the focus should be on improving health infrastructure. Let there be a multi-specialty fully funded one hospital come medical college for at least 8 lakh people in each and every part of the country. Increase the health budget of the central states to at least 6% of GDP. These are the only things which can provide what we call long-term solutions to the crisis. And finally, actively involve civil society organizations, NGOs and media to create awareness among the citizens about health-related issues. Promote a healthy lifestyle among the people. In this way only we can tackle this kind of crisis in the future. I hope this discussion would have given you some kind of perspective regarding where the government went wrong and what should be done. Thank you very much. Best of luck.